इसको आप कर दो अनलिस्ट, है ना, उसमें क्या होगा तो ना वो नहीं होगा। वहाँ जाइए DCDC यूट्यूब स्टूडियो में ही नीचे है। हाँ वीडियो में नीचे वापस नहीं करेंगे। Hello, hi, very good afternoon to everyone. I got a comment message from NSHD Gaming. Hi. You can type your name here, so just we can connect with you actually.
Your name and your center name. डिलीट कर दो, इसको डिलीट
अनलिस्ट कर दो। Hello guys, so today we will discuss about the cannulation techniques. I am Sanjay Chaudhary, Manager Clinical DCDC, and Dr. Yasir.
Hi everyone, I am Dr. Yasir, DCDC Kidney Care. Welcome everyone.
Okay, so we will wait to join more pupils in 5 minutes. Then after 5 minutes we will start the session. Okay, from Ambala. What is your name? NSHD Gaming. Actually, your ID is showing NFHD. So can you type your name here, please? Hello guys, so we are getting more participants here. The Furkan official. Okay, Furkan. After 3 minutes we will start. So let the more people connect. Okay, so guys, today our topic is cannulation techniques for AVF. So there are some basic things for the AVF. AVF is the lifetime of the CKD patient that you, the technicians and other people knows very well that how much AVF is important for a dialysis patient. So it is also very important that we have to cannulate the patient fistula in a very good manner so that the patient can get adequate dialysis and the lifespan of fistula can be increased. So there are some few techniques of the fistula cannulation. So if people adopt in the dialysis, so patient can get a good and effective dialysis treatment and the lifespan of fistula can be increased. Okay, so guys, if you have any queries and question about the session or cannulation techniques topic, you can comment here. After completing the session in 15 and 20 minutes, we will answer your one-to-one questions. Okay. So basically, what is AVF? What is AVF? AVF is basically an anastomosis made by connecting an artery and a vein to get adequate amount of blood during the dialysis. Okay. इसमें नहीं आ रहा है तुम कनेक्ट नहीं आ रहा है क्या नहीं है
ये मेरे में तो आ रहा है लाइव
हम चलेंगे
Sorry for that. Sanjay, okay, again start with the introduction.
Okay guys, so we are starting our topic about the topic or the about the cannulation techniques. If you guys have any question and queries, you can comment in the comment box and we will take your questions after completing the session. So basically, before starting the topic, I just want to say that what is the cannulation technique means. Cannulation techniques means the appropriate way of cannulating a patient AV fistula so that the patient can get adequate dialysis and the lifespan of fistula can be increased. So as all people knows that ABF is the lifeline of the patient. Like if a patient has a good and effective ABF or blood access in the dialysis, only then he can get a good dialysis or can improve or increase your life survival. So patient fistula or ABF is very important and mandatory for the patient to survival with CKD. So as we are technicians knows that a patient need to get twice or thrice dialysis in a week. So twice or thrice we have to cannulate a patient fistula. So there are some special techniques are designed to cannulate the fistula in an accurate manner so that the patient fistula lifespan can be increased and patient can get adequate dialysis. The both words I am saying again and again because these two words are very important. First one is getting in an adequate dialysis with proper cannulation techniques and increasing the lifespan of the patient fistula. So now we will talk what is about the ABF. What you mean about the ABF? So if anyone want to describe or know anything about the ABF, he can comment in the comment box. ABF means a way of connection for artery and vein for hemodialysis so that we can get adequate blood flow for hemodialysis. So in fistula, we make an anastomosis between an artery and a vein. We connect it together. It's bilateral, end to end. There are many type of anastomosis. Then some of artery blood flow transmit to the vein, so we can get an adequate blood flow for dialysis from the vein only. That is fistula. So there are many types of fistula known: radiocephalic fistula, है ना, brachiocephalic fistula. Okay. So now what is cannulation? Cannulation techniques. Cannulation means penetrating a patient fistula via a needle to get the blood flow for hemodialysis. It is known as cannulation techniques. Okay. So first we have to know about the needle. What needle we are using for dialysis, what characteristics and what we have to ensure about the needle. The needle basically we use for hemodialysis patient to cannulate fistula. There are several type of needles available in the market for the independent fistulas according to their fistula maturation or to get the flow for the dialysis, the type of dialysis. So there are several type of needles are available in the market. Basically we use 16 and 17 gauge needle to cannulate a patient fistula. Okay. So generally we use 16 and 17 gauge needle to cannulate a patient fistula for hemodialysis. So what attribute should be in a needle? Like if you are choosing a needle to cannulate a patient fistula, then what attribute you have to take in your mind before choosing any needle for to cannulate AB fistula. So there are some attribute you have to take, like what the needle length, the needle gauge, and what the fistula maturation, where the fistula was made. You have to take care of all these things. Okay. So apart from the needle attribute, you have also check the ABF assessment first. Like before you are cannulating a fistula, you have to take the ABF assessment first. That whenever patient is coming for the dialysis, you have to check patient fistula. Okay. You have to make some assessment before cannulating so that you can decide that the fistula can be cannulated by you or by other technician or not. Like patient fistula in the condition to be cannulated or not. So you have to make some assessments before the cannulation. What assessment will be? You have to check first the patient physical examination. Like when you see the patient fistula, so you have to ensure that there are no sign of infection. How will you check the sign of infection? How will you get the information that there are some infection or not in the fistula? If patient ABF get infection, that there may be a sign of redness, pus discharge, and patient will complain about the pain in the dialysis. So if these kind of signs are seen in the patient fistula or patient complaining about this, that you have then there are the patient fistula is infected, so there are some infection in the patient fistula, then you have to avoid the cannulation. The apart from the physical examination, you have also feel the thrill of the patient fistula and root. You can just feel the thrill of the patient fistula, that it is adequate working or not. You can get to know by the thrill checking of the fistula. After it, you can also use a stethoscope to check the patient breath, if the fistula is working fine or not. So, if the patient fistula is working fine, you can listen a breath-like sound in the stethoscope. So, if the sound is present, then you can say the fistula is working good and it is ready to cannulate. But there are breath is absent, the voice is absent in the stethoscope, then the fistula is not working appropriately and you cannot cannulate that. So before cannulating the fistula, you have to make the analysis or examination of the AVF. Then fistula is able to cannulate or not. So you have to check the physical examination first, like visible. There are no sign of infection. There should be no sign of inflammation. You have to check the fistula thrill. You have to check the root as well before cannulating the fistula. Okay, so after the physical assessment or the analysis, now you have to choose the correct gauge size to cannulate the patient fistula. Like you have to check the patient age, the how the patient flow is there, maturation. What is the maturation time of the fistula? When the fistula was created, it is the first time fistula cannulation or patient has taken dialysis before from the same fistula. So, if a patient is regular on the hemodialysis and taking dialysis twice or thrice a week, so you generally we use 16G needle to cannulate the fistula. But if the patient is coming for the very first time or second time for the dialysis, then you have to choose the 17G needle to cannulate the ABF fistula. Actually, there is no thumb rule for the flexion of the needle, but you have to check that when the fistula is new, so the veins are not very well created. There are some sign of infiltration or a counter during the dialysis. So whenever the patient is coming for the first time or the second time, you have to start with a 17G needle for the patient fistula. Then after for the multiple cannulation or patient is coming regular for the dialysis, then you have to use or you can use 16G needle for a dialysis patient for fistula cannulation. Okay. Anything you want to add?
Now we talk about the now we talk about the infection part. Okay. Now you have okay. Now you have checked your fistula. Everything is good. You have seen the thrill is good. Your fistula is mature enough. You can put the needle. Okay. So the cleaning part is very important. Whenever you want to cannulate the fistula, the infection protocols are very important, because fistula is the life of patient. If anything happens to the fistula, that can be a hematoma, that can be an infiltration, that can be an infection, that will have an extra burden to the patient. So as you all know, we are just repeating the things. You have to clean your fistula with chlorhexidine solution or betadine solution. Okay. And the way you always know, like how to clean the, like from the center, you have to go to the periphery and clean the both the sides where you want to cannulate. Okay. So sometimes the technicians tell us that they can't feel the fistula while wearing gloves. So that can be a problem, but if that can be a problem with some patients, not all the patients have this problem. So you can feel the veins without gloves, before cannulating, and after that when you know, yeah, you can feel the vein very well, vein is prominent enough to you can cannulate. After that you can wear your gloves and clean the access site, and then after that you have to cannulate the vein. But always remember that you have to wear gloves always whenever you are doing any aseptic procedures. Okay, so there are some complications also while doing the needle. So the most common thing is infiltration. Infiltration is like you are putting a needle inside the fistula, and it's not going inside the vein, but it's going outside in somewhere in the muscles. So everyone know about this complication, and it's very common in dialysis units. So remember this thing, like whenever you are putting a needle in the fistula, always feel it proper. See the proper length of the vein, that if you cannulate in this much area, the length of the vein will go inside properly. If the vein is not can be filled properly, if you cannulate that fistula, then there are chance of infiltration. Okay, so remember these things are very important. Okay, sometimes there is a problem in the flow. Okay, so whenever you cannulate the fistula, so remember this thing, like you can use a 5 ml syringe with filled with NS, and you can check the flow before putting connection to the machine. So you can check both the machines. Yeah, you can check both the needles, flow is coming very well. So थोड़ा सा भी टेक्निक्स वगैरह डिस्कस करिए.
Okay guys, so after just Dr. Yasir sir has told us about the initials for starting a patient fistula or cannulation technique. Now apart of this, there are also some type of complication arises in the fistula. Many times we also have to check, like the first one is infiltration. So sir has told us that infiltration means whenever you are trying to cannulate a patient fistula, so in place of patient vein, it goes inside the patient arm and put somewhere in the tissues, you know? So that is known as infiltration. The next. Okay guys, so next is aneurysm. So aneurysm means basically the balloonation of the patient vein, yeah, vessel. So when a person is cannulating a fistula on the same place, so many times the patient vein become like the balloon, you know? So this is basically aneurysm. Okay, now we will talk about the angles and the 3-point techniques. What should be the angle for cannulating a fistula? So there is also no actual thumb rule for the cannulation of the angle, but you generally you have to put the needle in the fistula on 25 degree. Okay, you have to take a needle in your hand and have to insert on the 25 degree on the patient arm for the exact cannulation. But before choosing the angle, you have to also check the depth of the vein, that how deep is it in the arm, or where the fistula is created, and what is the segment side, what is the flow direction, everything you have to check before the cannulation. Okay, so now what technique should be used about for the cannulation? Now, if you guys anyone knows about the cannulation techniques, that what type of techniques are there for the fistula cannulation, so that you can comment here in the comment box. There are many types of cannulation. Okay, so basically there are two types of cannulation techniques generally we use. The first one is buttonhole techniques, and second one is known as rope ladder technique. The buttonhole technique basically known as when we used to cannulate a patient fistula on the same place or same point. Uh, the technique is known as buttonhole techniques. In this scenario, the patient feel, and we also can use a blend needle for the buttonhole technique, cannulation techniques. The second one is rope ladder technique. Rope ladder technique known as when every time we change the cannulation point. Like if I can share tell you.
You can
Okay.
draw a diagram on the board. So now we'll show you a diagram of some techniques.
Okay, guys. So there are two types of cannulation techniques we generally use in the dialysis. The first one is buttonhole technique. The second one is rope ladder technique. Okay, so there are basically two types of cannulation techniques we generally use or we can use in the hemodialysis to get the adequate amount of blood flow for hemodialysis.
Sanjay, can you show me the diagram of how the buttonhole technique look like, and the rope ladder also?
Exactly.
So it will be better for technicians to understand.
Exactly. So buttonhole techniques means, as I have already told, that the buttonhole techniques means cannulating a patient fistula on the same place or same point. So we just say that this is a patient arm and this is the radiocephalic fistula. This is the anastomosis that take place here, and this is the flow direction of the blood in the patient arm. So now if we use, and we have made it our cannulation point here. Okay. Up now for the each dialysis, if we use the same point for the dialysis, it is known as buttonhole techniques. Like we are cannulating the patient fistula on the same point again and again or every time. It is known as buttonhole technique. So there are some advantage and disadvantage of this kind of cannulation techniques. Basically, in this kind of technique, the patient feel less pain in the dialysis, and it is easy to cannulate. Like a trainee staff or a normal technician can cannulate this kind of fistula easily. But there are also some disadvantage that patient can cause the severe complications due to buttonhole technique. Like there may be a chance of aneurysm. Okay, so if we used or we choose the same point of the patient fistula for the multiple cannulation, so patient there may be the chance of aneurysm. Generally, we should avoid this kind of cannulation in the dialysis. The second one is rope ladder technique. What is rope ladder technique? Rope ladder technique means during the dialysis, every time we have to change the cannulation point. Like if this is a patient arm, this is the anastomosis, and this is the blood flow direction in the patient arm. So for the first time, we will use to cannulate here for the dialysis, and when patient will come again for the dialysis next time. Okay.
There is some electricity problem.
Okay, then again we will use the second point here again in the second point here. So in this scenario, the patient can feel pain during the cannulation, but it is also helpful to increase the lifespan of the patient fistula.
So, Sanjay, in this technique, like every time we are changing the site of the patient.
Exactly. So every time we have to change the patient prick point basically.
Okay.
When the point you are cannulating the fistula, you have to change the point every time. Due to the change of the point, the point will get the enough time for the heal.
To heal back.
To heal back and again ready for the cannulation. So these were basically the type of cannulation techniques, what the type you can use for the patient fistula cannulation. Okay, the next is the sign of infiltration. How you can appropriately and you have fistula. Now, how you can check that there are some infiltration in the patient arm or fistula? So patient will feel severe pain during dialysis.
Yeah.
If the fistula can get infiltration, patient will feel severe pain in the point of the cannulation. So that is the sign of infiltration. Again, you will feel some little edema or swelling in the patient hand, and the patient flow will not be accurate. So if these signs are you are feeling in the dialysis, so you can say that your needle has get countered and you have to prick the patient fistula again.
Securing a needle is also a very important part of cannulation. Like many times I've seen like the technician put the needle very well, but after some times, like maybe due to that can be a complication due to from the patient side, or maybe due to wrong positioning. Like sometimes we see that the needle is out from the place.
Exactly.
So what do you think, like putting a proper taping or proper micropore is very important part?
Actually, it is very important because this is the 4 hours dialysis therapy and you have multiple patients at the same time. So when you have started a patient dialysis, you may engage for the other bed for take care of the second patient.
We can't sit 4 hours in front of patient. What the patient is doing, maybe he is removing his hand, maybe he is doing something. So we have to be very much secure at that time that the patient needle is very much positioned very good.
Very good. So many times staff or technician basically many times do that, they just put the needle in the fistula and tape it from a single micropore. So this is the wrong technique. Basically patient the needle can come out during dialysis and the heavy blood loss can be occurred during dialysis. So staff guys, you have to follow the proper chevron technique for the dialysis. Securing of the fistula needle, so that if you are engaged in the other patient or you are not at the patient side, the needle should be very secure during the dialysis, so the blood loss can be avoided during the hemodialysis. So securing of the ABF is
what is that technique?
So basically we can understand on the board like what is the chevron technique actually.
So now we will tell you the technique how to secure the needle to get a proper
flow. So if this is a needle injected in the patient arm, so it has to be properly covered in this manner. This is known as chevron technique. Okay, or also known as butterfly techniques. Many people used to say chevron technique or butterfly technique. It secures the patient needle in the arm properly and avoid the blood losses during the hemodialysis. So always you have to use the chevron technique during the fistula cannulation.
So putting a needle just like putting a microphone on a like fistula needle, it's not good.
It's not good. It can occur severe blood loss during the dialysis. Post cannulation observation, like now if you have cannulated a fistula very well, this is also important to to ensure or observe the post cannulation observations, like what the thing you will check after the cannulation, yeah, post cannulation. So basically you have to check the machine alarm and proper pressures, yeah, venous pressure or arterial pressure in the hemodialysis. Like you have cannulation, so you have to check that the arterial pressure and venous pressure in the dialysis should be very appropriate. Like it should be around 150, say 250, between the 150, 100 to 250. So if the venous pressure is maintained, you can say that you have made the fistula cannulation properly. But there are the pressure fluctuation in the line or showing in the machine multiple time, so machine will alarm and it indicates that your needle is not properly cannulated in the patient fistula. So you have also, okay guys, so after the post cannulation you have to ensure the to check the penis pressure in the machine and the alarms for the cannulation. Like if you can, many times technicians get complaint from the patient that he was cannulated well during dialysis, but when the patient has gone at the home, his patient arm has swelled, है ना. So technicians basically people say that during the dialysis the cannulation was okay, it has happened after when the patient has gone home. So you have to ensure that there will be a little sign of filtration in the dialysis. So the venous pressure should be very maintained during the hemodialysis. If the venous pressure is not adequate or getting high, it means that the needle is not properly positioned in the patient arm or fistula. So you have to check the machine alarms after the cannulation and post cannulation. Next, the blood leak. You have also checked the blood leak post cannulation. Many times, as we are discussing about the buttonhole technique. So in the case of buttonhole techniques, many times the complaints arises of the blood leak, because when you used a single site for the multiple cannulation, so the nearby your skin cell are the dead and the blood leakage occur from the fistula during dialysis. So after the cannulation you have to check for the blood leak for the in the cannulation. Next is swelling. You have to check when you have created a fistula and start the dialysis. In the regular period, you have to ensure that there are no swelling in the patient arm or AVF arm. If there is any sign of swelling in the patient arm, it means that your needle is not positioned properly in the patient fistula or vein. So you have to check the swelling for the during dialysis. So during dialysis. Okay. The next is BFR, blood flow rate. Whenever you are using a 16G needle or 17G needle to cannulate a patient fistula, the adequate blood flow you have to achieve. If you have cannulated with a 16G patient fistula and your blood flow is not even maintained on the 200 or 250, it means it means your needle is not properly positioned in the patient fistula or vein. So if you are not getting the adequate blood flow, if your blood flow rate is minimum for the dialysis, then you have to check your cannulation first.
So Sanjay, like what do you say if we are starting a new fistula and it's the first day we are putting a needle in the fistula, so how should we like how much we have to maintain the BFR of that patient?
Okay, so actually whenever we are using a first dialysis of a patient, so actually we have to make established patient for the hemodialysis. We are not very much concerned about the clearance or adequacy for the first time dialysis.
Okay, at the first day we want to just start the fistula and don't trouble the patient much.
Exactly. So whenever we are starting a new patient fistula, we have to use or we can use a 17G needle for the dialysis, and we have to maintain 150 to 180 blood flow during hemodialysis.
Okay. And we have to, like, throughout the procedure we have to see like if there is any complication,
if there is
patient is saying any complication, we have to monitor that also. Like so many times Sanjay, I have seen like after putting a needle that the after the cannulation was very good, but I have seen like there is some local swelling around the needle, and the flow of the needle is not coming properly. What we have to do?
Okay, so when we are cannulated a fistula and we are showing that there are swelling in the patient arm.
Yeah, it was started well. There was a better flow, but after 10 to 15 minutes, now there is some swelling, and the patient is saying like, Sanjay, I am having some pain, and there is some swelling, and the flow is not coming properly.
Exactly. So in this case, we have to check the venous pressure actually.
Okay.
Because in the beginning, and we just cannulated the patient fistula, there was mild infiltration.
Okay.
Which is not come into the notice at the time of starting.
Okay.
And we have thought that the needle is properly cannulated and position is all okay, and we start the dialysis. But in this case scenario, if we check the venous pressure from the beginning, the venous pressure will be high. Okay. And we get the high venous pressure and alarms during dialysis. So if we are getting the frequent venous pressure alarm for upper venous pressure alarm during the hemodialysis, so there are chances that your needle is get stuck in mild into the tissues. Okay. So there was mild infiltration during the cannulation. The another reason can be that patient has moved his hand, you was not tapped properly or not secured properly, you was not used the chevron technique for the dialysis. So those reasons can also be happen in this scenario. But if the patient, if you have cannulated the dialysis patient fistula well, then after 15 to 20 minutes patient is complaining for the swelling and you are getting the patient arm swelled, that means there was the mild infiltration from the starting which is not coming to the notice. But in such scenario, you have to monitor your venous pressure. If you are getting the venous pressure very high, that your needle may not be properly positioned in the patient arm or fistula. So you have to check that.
Okay, sometimes Sanjay, I have seen like you put the needle very properly, and after some time patient want to sleep or something, or he is not very comfortable. So he said, oh, okay, I sleep during dialysis. So he cover his body, he cover his hand, and everything is covered. And now you can't see if there is some bleeding from the fistula side, or maybe there is some problem in the needle. So I have seen so many times like there was some oozing, but patient is covering his hand fully under the blanket, and we can't able to see that oozing, and now there is a blood loss, and patient will complain that my needle was not properly put, and now I am having a like problem. I have a blood loss due to this technicians. So due to this technician, that the needle was not done properly. So you also have seen these cases. So what do you want to say about
exactly.
that thing?
So actually, I have also personally seen multiple cases of this blood loss of the patient from the patient fistula or cannulation or needle fight. So actually, the dialysis is 4-hour treatment therapy. So we cannot say patient that you can't sleep. We have to get the time patient to sleep because there are
some time patient used to sleep. Okay.
But the staff or you or me all basically have to be very straight for the monitoring of the patient during the dialysis. Like a patient is sleeping, so the first thing is come that you have to use the chevron technique, have to place the proper taping of the at the cannulation or properly secure the needle very properly. Okay. And never hide the line from the patient in the blanket.
Okay, if he is covering the
if he is
sleeping also, he is covering his face.
He is covering his face body, but the side
that should be open. That should be
always the side and all the line should be open or visible easily to a staff.
Yeah, because if there is some problem in the line, or there is some oozing, so we can see that problem and we can take action as soon as possible.
So the patient blood loss can be avoided in this case.
Okay.
So immediately you cannot hide the patient blood line or fistula arm when the patient is sleeping. You have to make it open all the time. So, okay. So after these things, after the cannulation, we are also have to know about the decannulation techniques. Like when the dialysis is complete of the patient, then how you will remove the dialysis or remove the patient needle from the AVF so that the no complication should be seen in the patient. So basically the preparation, the first one is preparation. Whenever you are going to decannulate a patient or removing the needle from the patient fistula, you have to prepare first. Like you have to assemble all the assets you required. You have to make the off kit at your, you have to make a proper tray, you have to the syringes whatever you need, you have to micro pore gauge. So first thing is come the preparation, you have to prepare first for the cannulation. The second is uh, disinfected tray, like the assembled, you have to assemble all the things, you have a disinfected tray, okay, like whatever tray you are using for the decannulation of the fistula, the tray should be very disinfected or sterile gauze you have to use, like we are providing off kit at the centers, and where the off kit is not available you can use the autoclave for steriling the gauze. So you have to prepare first, and then you have to remove the needle from the fistula very gently, because multiple times the complaint comes that the fistula was okay but it was swelled when the technician was removing the needle from the fistula, or not make it tight properly, so the heavy blood loss is seen for the patient. So this is also very important for the cannulation technique. Then whenever you are cannulating a fistula, you have to decannulate it very well. Okay, so first thing is preparation, you have to prepare very well for the fistula. And the second thing,
like yeah, so many times Sanjay I have seen, like we have finished our dialysis very well, the 4 hour dialysis was very good, patient was very satisfied, and while removing the needle back from the fistula there was some problem, or maybe there was some pain to the patient, and again he complains that yeah, the technician did not remove my needle properly, or maybe he have some blood loss, maybe it can be because while removing the needle you have to be very careful while putting a gauze on the point, you can't pressure it very much, you can't do it very loosely, so that technique is very important. Yeah,
exactly. Okay, so guys, now if you guys have any question about the cannulation techniques or related question you have in your mind, you can just put it in the comment box,
so we can answer them.
We will try to answer your all the questions very well. So guys, if you have any question about the topic, you can put here in the comment box about the cannulation techniques. Okay, I think done.
Like one thing I want to share with the technicians, like the number of technicians are very less this time, I don't know why, and this English session is especially for the people from the Telangana. So we are conducting a session in Hindi, and again we are like doing this session in English because in Telangana there are so many technicians, they don't understand Hindi. So please convey this message to all your friends, your senior technicians, your junior technician, your staff, your friends from other centers also, so that they can join the session, and it is beneficial for them to revise everything, the techniques what we are saying, the problems what we are discussing, the complication what we are discussing, they are facing these things in their daily practice life. So it's better they will attend these sessions, they can discuss with us, they can ask their doubt, they can learn some new things, they can refresh their memories, maybe some so many things they know before also, but they are not practicing those things now, so they are not using in their daily practices. So after watching this session, so maybe you now know some new things, or maybe there are some refreshers things you already have been knowing about it but you forgot sometime. So it will be better to attend a session. It will be a 1 hour session. So, and you can ask your doubts also. We always have doubts sometimes, like how to do this thing, how to do that thing, but there is no one to ask, because usually we don't conduct these kind of things. So it will be better for technicians to understand these things very easily. So we want, like, many, like most of the technicians, they will join and they will gain some knowledge, and we have a good interactive sessions. So as I'm seeing, there are no comments or no questions right now, so we can close the session. And thanks for watching, and we will come next week also with some new topic. Stay tuned. Bye. Sanjeev?
Yeah, of course, as sir has told that this session is specially designed for the peoples of Telangana in the English basically. So maximum people are required in this session, and your comments are also welcome and very important, so that we can interact basically from each other. So we'll connect next time. Thank you very much.
Bye.